Hello patients at Boundary House. With autumn and winter fast approaching, we will see a rise in symptoms of the seasonal flu. Things can get a little bit cloudy with COVID in the background, so join us in this 3-part series where we're going to discuss COVID, flu, common cold symptoms, and most importantly, when you as a parent should worry about these symptoms and what you can do about it and self-manage with confidence.
Right, my child's got a fever. Should I be worried?
It's a really good question, and something that happens, with every child and every baby at some point in their life. Yeah, so a temperature above 38 degrees, that's when we call it a temperature. Anything above kind of 37.7 onwards, that's a low grade fever. And we worry when temperatures are kind of 39 and above, we think about more serious causes, okay? Do you know what we'd give to a child or a baby that might have a fever?
Could we give paracetamol?
Yeah, that's brilliant. So paracetamol, which is also known as Calpol, and we can also give, if the child's able to, ibuprofen, which is Nurofen as well.
How long would it normally last for?
So a really good question. It depends on what the cause is, okay? If your child has a temperature and no other symptoms and is otherwise well, then we definitely recommend booking your child in for a COVID test, okay? And isolate the rest of the house. If your child has other symptoms and a temperature, the first port of call, you can call us, and we're going to talk about other symptoms that you may not need to talk, or call us straight away.
Right, my child's woke up this morning with a cough. Should I be worried?
Okay. Really good question. So coughs are really common, especially in babies, toddlers, young children. If your child is just a cough and no other symptoms, then we don't normally worry. They're still kind of eating and drinking, going to the toilet as normal, and they're allowed up to 3 weeks of coughing, okay? If it's a persistent new cough, then we do recommend your child getting tested for COVID.
And will they need antibiotics if it goes on for that long?
Really good point, because 3 weeks sounds like a long time, doesn't it? The most common cause of a cough in a child when COVID's ruled out tends to be a common viral, a virus, a bug, okay, that doesn't require antibiotics. So as I say, if your child's otherwise well and it's just a cough and no other symptoms, we don't prescribe antibiotics.
I think my child's got a cold. Should I be worried?
Okay, really good point. When you say cold, what do you mean by that?
Oh, it's full of snot, bit of sore throat, earache. It's not feeling themselves really.
Yeah. So a lot of multiple different symptoms then. So we could go through each one and I'll tell you when we worry and when we don't. Would that be helpful? Yeah. So you mentioned kind of snot, really common in children, babies, and sometimes parents worry about the change in the colour of the snot, and really, regardless of what it is, we don't worry kind of about snot just running down on its own. Sometimes children can have a little bit of a temperature, be off their food, but as long as they're drinking plenty and otherwise playing and running around, we don't kind of worry about snot on its own, okay?
How long does it normally last for?
It tends to last anything from a couple of days up to 10 days, all right.
What should I give my child?
So to keep them comfortable, you can give things like paracetamol, as we mentioned, Calpol, and we can give Nurofen as well if the child prefers. You also mentioned a sore throat. That's another common presentation that parents ring up about. Anything particularly with a sore throat that you were?
I was just worried how long it's going to last for and whether it was more serious like tonsillitis.
Yeah, really good question. It's a sore throat on its own, child's just saying hurts a little bit, but still eating and drinking, and it's just happened, for example, today. We kind of worry less about that, okay? If your child's got a temperature with it, they're not really eating, not taking much fluid in, saying it's really painful, it looks inflamed and angry, then that could be evolving into a tonsillitis, and we would want to kind of speak to you more detail about that.
And do you need antibiotics for that?
Yeah, so if it's a tonsillitis that's more likely to be caused by a bacteria, then we do give antibiotics for that, and that would help your child get better if it is a tonsillitis. If it's not a tonsillitis, giving antibiotics won't make a difference, okay?
Okay.